My name is Morénike Giwa Onaiwu.
My name is Heather Watkins. I am a Boston-based disability rights activist.
I am a disabled mom and advocate in the United States.
My name is Laurie Bertram Roberts. I'm the executive director and co-founder of the Mississippi Reproductive Freedom Fund. I do reproductive justice work in the South. The joys of Black disabled motherhood is the same as other people's joys of motherhood. Like, we love playing with our kids. We love going places with our kids. We love reading to our kids. We love, snuggling with our kids. We love doing all the same things with our kids that other people like doing. It's just that we might do them differently.
We aren't just a disabled woman, and we aren't just a Black mom. We are a Black mom who is disabled. So we're bringing all of that, all aspects of that, the resiliency, the creativity, the innovation, the history and the strength of our people. We're bringing all of those things together in our parenting journey.
A lot of people probably don't even consider how beneficial disabilities are. They only think of what the limitations are, but it's actually a very comprehensive life experience. But across the media landscape, we don't really see all of that. We see pity and pedestal, sadness, and it's so much more than that. It's a very rich experience.
Children who have parents who are disabled tend to be children that are really, really open-minded, strong, children who have an understanding of difference and great respect for people. And they understand that the value of people and the way people do things can look different ways. And so I think it equips them to go into a society that's so as diverse as ours.
I'm not less of a parent because you might not see me at an event or whatever, maybe because it's probably not accessible. I still love my kids, and I still ride for my kids, and my kids and I do stuff together all the time.
My children, my family, being a parent, it's just, I feel like you really, really grow as a person. Like, there is a sense of self, but when you are caring about and caring for and responsible for someone else, I feel like it really causes you to rise to the occasion. It causes you to look at this world through a whole completely different lens. It's one of the most rewarding and beautiful things. The judgment, the stigma, the low expectations that people have of us, our invisibility, is really one of the most challenging aspects of a Black disability motherhood.
Assumptions that I get as a Black disabled mom: that I don't care about my kids, that I don't show up for them, that I don't know what they're doing. Whenever you are a Black parent, you are going to be policed by the school system, by the medical system. And when you're a disabled Black parent, then you get the additional stigma of maybe you don't understand things. Like, they assume that you don't understand things as much, or assume because maybe someone else is helping you take kids to doctor's appointments that you're not as involved, or you don't care as much, or so you're constantly battling like these stigmas or these assumptions about how much you care about your kids, how much you love your kids, how much you live around for your kids. I dealt with that with the public schools a lot, and with the medical establishment.
Racism, misogyny, ableism all impact your ability to get care because people don't think you're the highest priority. Your life doesn't matter. You're not believed in terms of pain management and things like that. And you always questions about whether you're exaggerating, whether things are all in your head. Maybe you can't get reproductive health care because you can't get an examination. Or you can't get a breast exam because you can't access the mammography.
We can't even get respected in this space. And I'm not even starting on sexual health, because half the time they don't even want to acknowledge that we use our body parts for sex. Like, they think we're not even sexually active. I can't even get listened to when it's my care, and then I can't get listened to when it's my kids' care either.
Because of the fact that my child is Black and dark-skinned, the marks on his skin didn't look like those in the textbook. Although he met the criteria, because they did not recognize the criteria, he wasn't diagnosed properly. And I was gaslit and made to feel like I was a paranoid parent. And those types of things happen a lot. We're just seen as really poor historians and unreliable, narrators of our own lives and that of our children.
It's infuriating. It's heartbreaking. Sometimes it's just exhausting.
It would be great if medical care was just not racist first would be great. Medical racism being eradicated would be wonderful. But I know if wishes were fishes.
We also need to increase health literacy. I think that there's a way that people can be empowered to understand themselves and their care and their bodies and to advocate for them. And I think that people need to be respected and believed.
How do we have good quality Black maternal health care when people can't even be honest with their provider if they are, substance abuse is such a small amount, but it can impact so greatly people's outcomes. If you can't even be honest about whether or not you're using substances and then you're going underground because you're scared of going to the provider, that's a big freaking deal.
Things I would change around Black maternal health is education. It would be trainings for clinicians. It would be support networks for other Black disabled mothers, no matter what their disability is, whether it's a parent, not a parent. It lets you know that you matter.